The BD Nexiva closed IV catheter system is an integrated solution for peripheral IV cannulation and aims to provide a safer and better means of administering IV therapy. Nexiva also has an integrated extension set combined with BD Connecta 3-way stopcock and integrated BD Q-Site lower access split septum device. The Nexiva closed IV catheter system consists of a number of key components: BD Q-Site closed lower access, air vent, Y adapter, 3-way stopcock, pinch clamp, extension tubing, finger grips, needle safety shield, and stabilisation platform. The Nexiva Connecta stopcock version also contains a single Q-Site and end cap. Nexiva is available in a range of sizes from 18 gauge up to 24 gauge, with a choice of needle length for each gauge size. Before taking Nexiva out, check the packaging is intact and also check the expiry date. The expiry date for the Connecta stopcock version can be viewed on the reverse side of the paper cover. Peel back the paper cover from the identified corner and remove the Nexiva from the packaging. Nexiva allows for administration of 2 infusions or infusion and bolus, while the stopcock version includes an integrated extension set with a clamp and a stopcock adapter. There is also an additional Q-Site lower access device or an end cap with a stopcock version to replace the air vent. The stabilisation platform is for increased patient comfort and helps minimise catheter movement and displacement in the vessel, which may help reduce complications. Nexiva features kink-resistant Vialon technology, which softens up to 70% inside the vein and aids in increased dwell times and can reduce the chance of mechanical phlebitis. Nexiva has been designed to accommodate a variety of grip techniques, and you should adopt your preferred grip. Platform and push tab. Platformed technique. Straight technique. To perform the cannulation with Nexiva, first apply the tourniquet. Palpate the vein to find a suitable site appropriate for the infusion to be administered. The skin should be prepared with an appropriate antimicrobial agent and allowed to dry, following your hospital policy and procedures. Remove the protective needle cover. Nexiva has a tapered cannula tip, which ensures smoother needle insertion and helps minimise pain to the patient. Holding onto the stabilisation platform, pull back the white tab approximately 3 mm, 1/8 of an inch on the finger grips. Then push the finger grips back to their original position, making sure that the coloured stabilisation platform and finger grips fit snugly together. Insert the needle into a suitable vein at a low angle, providing skin traction where appropriate. Nexiva features InstaFlash technology, which is a notched needle designed to increase first stick success by confirming vein entry. Look for the primary flashback along the cannula and stop advancing. Lower the cannula towards the patient's skin for a lower insertion angle. Insert the whole device a further 2 mm to ensure the cannula tip is inside the vein. Support the stabilisation platform and pull back on the white tab 2 to 3 mm and observe secondary flashback in the extension tube. This integrated system creates a closed fluid path which is designed to reduce blood leakage from the cannula and minimises the potential for contamination to the patient and blood exposure to the healthcare worker. Nexiva can be advanced into the vein using your preferred method. Use the one that suits your technique best. Hooded technique. Advance the whole unit into the patient's vein with the needle inside the cannula so the cannula leads the way in the vein. One-handed technique. Place your index finger on the grey push tab and advance the cannula forward off the needle, being careful to hold the needle stationary. Because the white and grey pieces separate, be sure that your thumb and middle finger are positioned on the finger grips. To increase your success, hold the needle stationary while advancing the cannula. Two-handed feed-off technique. Place your opposite thumb on the grey push tab and advance the cannula forward while holding the needle stationary. As the cannula is advanced, look for blood flow to continue up the extension tube. As the cannula is inserted into the vein fully, blood will continue to flow into the extension tube. When blood flows up the extension tube, it will stop at the vent plug, remaining contained within the system. Once the cannula is fully advanced, release the tourniquet before proceeding further. There is no need to occlude the vein. To remove the needle, support the stabilisation platform and the grey tab. Then pull back on the white tab in one straight motion until you hear and feel a click. Release the grey tab, hold the stabilisation platform and disengage the needle. Dispose of the white tab, which contains the shielded needle, into an approved sharps bin. As the needle is removed, it is wiped clean of blood as it leaves the silicone septum. This septum then self-seals, preventing any blood loss. Nexiva needs to be dressed to keep it secure in order to reduce the risk of mechanical phlebitis and to reduce ingress of bacteria into the insertion site. If the dressing is applied with securing strips, these should be sterile and placed on the stabilisation platform. Apply a transparent dressing over the insertion site and stabilisation platform, covering the septum and leaving the extension tube accessible. The date of insertion should be recorded on the dressing. Turn the tap to the off position to stop blood flowing out. Remove the vent plug and dispose. Attach a syringe with flushing solution directly to Connecta stopcock. Turn the tap to the on position and flush according to policy. Once flush is complete, turn the tap off and remove the syringe. Attach the white end cap. Disinfect the Q site with an appropriate swab, allowing time to dry. Attach another syringe with flushing solution directly to the Q site. Turn the tap to the on position and flush half the volume. Then rotate the syringe 180 degrees anti-clockwise and give the remaining volume to ensure the Q site is clear. Keep your thumb placed on the plunger while closing the tap to ensure positive pressure flushing, and to prevent disconnection reflux in the cannula tip. Turn the tap to the off position and remove the syringe. Clamp the extension line to stop blood flowing out. Remove the air vent and dispose. When Nexiva is in situ, this vent plug must be removed and replaced with a Lua access device, such as BD Q-Site. There is an additional Q-Site contained in each BD Nexiva pack. Remove the Q-Site from the pack and remove the blue cap. Attach the Q-Site directly to the Y adapter. Do not over-tighten. Disinfect the Q-Site with an appropriate swab, allowing time to dry. Attach a syringe with flushing solution directly to the Q-Site. Open the clamp and flush according to policy. Once flush is complete, close the clamp and remove the syringe. Hold on to the Q-Site when removing the flushing syringe to avoid accidental disconnection of the Q-Site. Disinfect the second Q-Site with an appropriate swab, allowing time to dry. Attach another syringe with flushing solution directly to the second Q-Site. Open the clamp and flush half the volume. Then rotate the syringe 180 degrees anti-clockwise and give the remaining volume to ensure the Q-Site is clear. Keep your thumb placed on the plunger whilst closing the clamp to ensure positive pressure flushing and to prevent disconnection reflux in the cannula tip. Disconnect the syringe and dispose. Care and maintenance is essential following the insertion of the BD Nexiva device. You must ensure adequate preparation prior to ongoing access. Disinfect the access port with an appropriate cleaning agent, allowing time to dry. Access the port using either Lua lock or Lua slip syringe for flushing. Turn the tap to the on position and flush half the volume. Then rotate the syringe 180 degrees anti-clockwise and give the remaining volume to ensure the Q-Site is clear. To avoid catheter reflux, maintain syringe pressure when flushing is complete, and at the same time turn the tap to the off position prior to disconnecting the syringe. Care and maintenance is essential following the insertion of the BD Nexiva device. You must ensure adequate preparation prior to ongoing access. Disinfect both Q-Site devices with appropriate swab, allowing time to dry. Access the port using either Lua lock or Lua slip syringe for flushing. Attach the syringe with flushing solution directly to the first Q-Site. Open the clamp and flush half the volume. Then rotate the syringe 180 degrees anti-clockwise and give the remaining volume to ensure the Q-Site is clear. Using positive pressure, clamp the extension. Then repeat the process again for the second Q-Site. Once you have finished flushing, ensure you close the clamp upon completion. Hold on to the Q-Site when removing the flushing syringe to avoid accidental disconnection of the Q-Site. The BD Nexiva closed IV catheter system is an integrated catheter solution. The device has been designed to minimise needle stick injuries and blood exposure during insertion. Nexiva features a passive needle safety mechanism which helps protect you from needle stick injuries, while the integrated closed system reduces the risk of contamination and infection by keeping blood where it belongs, away from the clinician. The Nexiva stabilisation platform is soft, flexible and designed to help minimise movement, which may increase indwell time. The BD QSight needle-free access system has 64 to 70% lower catheter-related bloodstream infection rates than mechanical valves. BD Nexiva helps promote standardisation as it reduces the number of components and helps achieve time savings.